A dermatologist is a doctor who specialises in treating and diagnosing all conditions to do with the skin, the hair and the nails. And they have more training after qualifying to be a doctor. So they undertake at least 2 years of training as a junior doctor in the general hospital system. And then they go on to do 4 years of specialty training before becoming a dermatologist. If you do need to see a dermatologist, your GP or your skin cancer doctor can refer you directly. Skin cancer is a result of damage to the skin cells from UV light, which is either from the sun or from solariums. We get skin cancer from cumulative UV exposure over time, so it does take some time for skin cancers to develop. But essentially the UV damages the DNA within our skin cells and that causes them to become cancerous. Skin cancer is more common with increasing age, and you are predisposed to skin cancer if you have fair skin, if there is a family history of skin cancer, and other risk factors include red hair or fair hair, blue eyes and freckling. Outdoor workers are particularly at risk given their lifetime UV exposure. Dysplastic nevi is another word for clinically atypical moles or larger moles. They tend to be a little bit larger than your normal moles, and they can have some redness to them and they can be raised in places, but they don't have the features of melanoma, and importantly they don't change with time. They are a risk factor of developing melanoma, so if you do have lots of dysplastic moles or atypical moles, you do need to be monitored carefully, and photography is really important to monitor these lesions. If you're examining your own skin at home, you should be checking for any lesions that are new or changing. You should be checking all of the surface of your skin and using a mirror to see the areas that are difficult to see, such as your back. You can often ask a partner or somebody at home to check your back and return the favour to them. You should be checking your own skin at the turn of each season, so that's 4 times a year, and that makes it easier to remember what you saw last time and become more familiar with your skin. Skin cancers develop typically in areas that are chronically exposed to the sun, so the head and neck and the arms in Australia are fairly chronically exposed to the sun as well. For melanoma, in women it tends to be more common on the legs, and for men more common on the back. Some skin cancers can develop on areas of the body that are not exposed to the sun, and that includes the soles of the feet and the palms of the hand, the nail and the scalp. So it's really important when you go for a skin check to have all of those areas looked at. Certainly it is common to have a melanoma arising as a mole that has darkened, but melanomas can also arise as a completely new lesion, and they can be skin coloured or pink, so not necessarily brown or darkly coloured. A melanoma should be suspected of any new lesion that is growing over a period of more than a month. So melanomas are changing lesions, and if there's any suspicion, you should see your doctor. Skin cancer is quite treatable in most cases with surgery, but in some cases it certainly can be life-threatening, and it can require other treatments such as radiation and also systemic therapies. We have a lot of new drugs that can be helpful in treating melanoma, for example, and there's been a lot of press about these, which is exciting for patients with more advanced disease. For patients who have had a melanoma, it's really important to have ongoing surveillance, both for the risk of that melanoma spreading, but also the risk of developing a second unrelated melanoma. Skin cancers contribute more deaths than the national road toll, and so these deaths are largely preventable with really simple measures. So people should be putting on protective clothing, wearing a hat, seeking shade where it's possible or keeping out of the sun, wearing sunglasses, and putting on sunscreen and reapplying sunscreen when it's needed. Sun protection is really important when the UV level is high, typically above 3, and you can get information of what the UV level is by using the SunSmart app or other weather apps, including the Bureau of Meteorology. Well, vitamin D is really important for bone health and general health. but we do get enough vitamin D through the day just with general exposure as we're doing the shopping or going to the car. We really only need 10 minutes or so a day over summer, and you will certainly get enough vitamin D even if you're wearing sunscreen. There are some exceptions. Older patients and people with darker skin types will need more UV exposure to get the adequate amount of vitamin D, and so supplementation is often a good measure for these people. Your vitamin D level will fluctuate through the year, so it will be lower over the winter months and it will naturally increase over summer. So it's not necessary to use sunscreen and sun protection over the winter months unless you're going to the snow or somewhere where it's glary. You really only need small bursts of sun exposure to get adequate vitamin D. And this sun exposure is best in the morning. You really should avoid prolonged exposure through the day when the UV level is high. Any sunscreen that is broad spectrum, that is, it covers UVA and UVB, and is also a factor 30 plus or above, is perfectly adequate so long as it is applied properly and it is reapplied after being in the sun for more than 2 hours. It should also be within its use by date.